Thanks for inviting me to participate in this august discussion. My sincere thanks go to the Office of the High Commissioner for Human Rights for hosting this discussion. And I'm pleased to join you today as a member of the Global Commission on Drug Policy, as well as a member of the Eastern and Southern Africa Commission on Drugs. As we mark 10 years since the historic 2016 UN General Assembly Special Session on Drugs, and 15 years since the establishment of the Global Commission, it is clear that the global drug policy landscape remains misaligned with our human rights commitments. These harms are not distributed equally. They fall heavily on marginalized communities, including Africans and people of African descent. The United Nations human rights mechanisms have documented how drug law enforcement has disproportionately targeted marginalized groups, including people of African descent. As they have noted, the so-called war on drugs has been operated less as a response to drug markets and more as a system of racial control. The Global Commission's 2024 thematic report demonstrates that these disproportionate impacts begin at the very first point of contact with the criminal justice system. Police stop and searches offer a stark example. In many countries, Black people are 6 times more likely to be stopped and searched by police for drugs than white people, despite lower reported rates of drug use. These inequities compound as individuals move through the system. Disproportionate policing leads to disproportionate arrests, which in turn fuel mass incarceration. And the Global Commission on Drug Policy, since its establishment in 2011, champions 5 pathways for reform that places human rights at the center of every endeavor. The Global Commission's appeal to all stakeholders is: 1, put people's health and safety first. 2, ensure access to essential medicines and pain control. 3, end the criminalization and incarceration of people who use drugs. 4, refocus enforcement responses to drug trafficking and organized crime. And 5, regulate drug markets to put governments in control. And so the whole issue of racism based on skin color is used to classify human beings and marginalize those who, in the eyes of the powers that be, have the different skin hue. And this is how racism is flourishing and discrimination is gaining currency as a matter of classification. And we know that drugs as well are classified. And yet, if we were to ask ourselves the question, what is the difference between medicine and drugs? And you would get to different responses to that question. Many would argue that the psychoactive substances that affect judgment, that affect perception, are dangerous to human beings. And yet, alcohol and smoking are not prohibited. They are freely obtained over the counter, and because they are part and parcel of the culture of the dominant classes in society, they are perfectly legalized. And yet, their harm to human life are more than some of the medicines that are classified as dangerous drugs. And so the thrust of the appeal of the Global Commission on Drug Policy is to understand that focus should really be on harm reduction rather than prohibition, because prohibition gives rise to abuses, it gives rise to gangsterism, it gives rise to a thriving economy, because demand rises as scarcity is used as part of the marketing of these drugs. And therefore, we welcome this opportunity for the discussion around discrimination which targets marginalized people, including Africans and people of African descent. We commend the High Commissioner for Human Rights in convening and hosting this session, which with specific focus on discrimination against Africans and those of African descendants. And so we hope that more traction would be gained around the 5 pathways of the Global Commission on Drug Policy, because this war, so-called war on drugs, is not only a failure, it is a costly failure, because it diverts resources towards incarcerating people who use drugs. And those are really not the problem. The real problem are the manufacturers, the traffickers, the main cartels behind drug production. This, of course, is compounded by the introduction of synthetic drugs, which makes this much more difficult. So this problem is compounded by the introduction of synthetic drugs, whose precursor ingredients are substances that can be obtained over the counter, and so it becomes this much more difficult to avoid harms such as overdose, because the consumers really do not know what ingredients they are consuming. And so we've observed that it leads to unnecessary deaths, and we once again believe that the 5 pathways identified by the Global Commission on Drug Policy should be supported and gain currency. And I thank you for your kind attention.